Hi guys, Dr. Dower here from Dower Pediatrics in South Florida. I wanted to talk a little bit about infant CPR, child CPR, and choking management for both age groups and how they differ. So infant CPR versus child CPR, not going to be so different. We'll talk about some of the management plans with respect to when the child falls down, when you have to call 911, but the ratio and the rate are going to be essentially very similar. So you're going to be doing 30 chest compressions and 2 breaths, and you're going to be doing them to the Staying Alive song. To give yourself that 100 to 120 chest compressions in a minute. When it comes to the breaths that you're going to be giving, those rescue breaths, you're giving 2 rescue breaths over the mouth, over the sealed mouth, so that 30 and 2 is what you're going to be doing with the infant and child. The biggest differences are how you're going to be positioning your hands and what you're going to be doing with your hands. When it comes to choking, and I will show you the differences with the hands. When it comes to choking, there's a big difference in what you do with children less than 1 year old versus older than 1 year old. When a child is less than 1 year old, you are going to be holding them on the forearm, and you're going to be laying that forearm on your thigh, and you're going to be doing the back blows and the chest thrusts that way. So you can be doing the 5 back blows with the palm, the base of the palm of your hand in between the shoulder blades, while the child is resting with their tummy on your forearm with their head below their abdomen to increase that intra-thoracic pressure to get that blockage out. And then you're going to fold them over onto your other arm and do the back blows. So chest thrusts, 5 chest thrusts, 5 back blows. Whereas in a child, anybody who's older than 1 month old, unless they're a 1 year old, unless they're a very, very small 1 year old, anybody who's older than 1 year old, you're going to be doing a different mechanism where you're actually using the Heimlich technique as well as the back blows. So you're going to stand the child up, kneel behind them, and you're going to be doing the abdominal thrusts, 5 of those, as well as 5 back blows between the shoulder blades, and I'll show you what that looks like. So remember, with CPR, 30 to 2, if you actually witness your child go down, call 911 immediately if you have your phone. If there's a bystander, have them call 911. If you don't have your phone, begin CPR, do 2 minutes of CPR, and then call 911. If there's an AED anywhere, have someone get it, or after 2 minutes of CPR, you get it. If you come in and you did not witness the child go down, we don't know how long they were down for, so immediately begin CPR if you have a child who's pulseless or a child who's not breathing and pulseless, okay? So let's take a look at what this looks like. So this is my infant mannequin. Let's say that I arrive to my infant mannequin and he's not breathing, or he seems like he's unarousable. I can touch him, hello, Andrew, hello, and let's say he's not responsive to me. I'm going to be looking for 2 things. I want to know, is the child breathing and do they have a pulse? So in a smaller child, their pulse is best felt at the brachial artery, right? We usually go for the carotid in adults, but the brachial for really small kids, or the femoral, and the femoral artery is going to be right in the crease of their thigh. The brachial artery is right at the inner elbow. That's where you're going to be feeling for a good pulse. And if you feel like you can't feel it there, you can always go for the radial pulse, which is on the thumb side, on the inside of the arm. For babies less than 1, let's talk about the brachial pulse. You're feeling for 10 seconds at most. By 10 seconds, if baby is not breathing and they have a pulse either less than 60 or they do not have a pulse, you're beginning CPR. Let's say the child does have a pulse. The pulse is more than 60, but they're having agonal respirations. They're either struggling to breathe or not breathing. If the child does have a pulse, but they have agonal respirations or they're not breathing, you're going to be doing rescue breaths. And I have my little mannequin right here, and unless you suspect a cervical injury, you can tilt the head. So what do? We push our little fingers on the top of the forehead down a little bit and just tilt the chin a little bit up to open up that airway and create a neutral sniffing dog position, okay? You're going to seal your mouth around the child's mouth and deliver 2 breaths if you're doing with CPR. Or if you're doing just rescue breaths, because the child does have a pulse, you're going to give a breath every 2 to 3 seconds. So you're going to breathe 2, 3, breathe 2, 3. So every 2 to 3 seconds, you're going to give rescue breaths. And you're obviously going to be checking for a pulse throughout. Let's say the child does not have a pulse or the pulse is less than 60, regardless of if they're having agonal respirations, if the pulse is less than 60 or you feel a thready pulse, you really don't feel it, or there's any question that the child doesn't have a pulse, you're going to begin CPR. So in CPR with the little ones, especially the ones less than 1 year old, you're going to locate the breastbone. So you're going to go right between the nipple line and locate the breastbone. Right underneath is the xiphoid process. You can break that off if you push too hard, but you want to go at the nipple line, maybe 1 or 2 finger breaths below. And with the really tiny ones, you can do 2 fingers and you push deep, hard, and fast, right? To the Staying Alive song, and you want to do 100 to 120. And that's too slow, right? So we want to do deep, hard, and fast, allowing for that chest recoil. Another way that you can do chest compressions besides the 2-finger method in a very small child is encircling your hands around the child and pushing with 2 thumbs, okay? So 30 compressions to 2 breaths. If there's a second rescuer, you can go to 15 compressions and 2 breaths. And every 2 minutes, you're going to be checking for a pulse. Going back to the brachial, checking for alertness, for a pulse, and with every respiration, you want to make sure there's chest rise. Let's say you have a child older than 1 year old. With a child who's older than 1 year old, for choking, you're going to be kneeling behind the child, and you're going to be delivering the back blows in the same manner between the shoulder blades. And that seems like it's pretty hard, but you do want to have that foreign body blockage expelled, right? And then when you're doing the abdominal thrusts for a child older than 1 year old, they're going to be ahead of you. You're going to have the thumb facing the inward part of the body, just directly above the belly button, and you're going to lean the child forward and give upward and inward thrusts, okay? When it comes to that ratio, you're doing 5 back blows, 5 abdominal thrusts, and remember, in the little kids, you're laying them on your arm, on your thigh, and doing the back blows with their head lower than their chest, and then you're going to move them onto the other arm and do the 5 chest thrusts, okay? 5 back blows, 5 chest thrusts for kids less than 1 year old, and then in a kid older than 1 year old, you're gonna start doing the Heimlich, the 5 abdominal thrusts with the 5 back blows. So for CPR in older children, instead of doing the 2-finger method or the encircling method, you're going to use the base of the palm of your one hand, same area, middle of the nipple line, maybe go 1 finger breath down, and you're going to do the 1-hand technique. Still 2 rescue breaths, 1-hand technique, and again, every 2 minutes you're checking for a pulse, and obviously you're awaiting EMS's arrival so that they can assist you with either a second provider or they probably have an AED. And that's just some really basic tips on choking and CPR in infants and children. If you want to book a live class, I do have a little packet where I give you all of the instructions, one that you can post on your fridge, it's magnetic, and then all of the instructions of CPR that I print out for you. Contact me if you need me.